Good morning. So I'm going to talk about biologics, don't forget me, enhancing the results, and how we kind of use them. Let's see, I'm having trouble with going forward. Okay. Those are my relationships. So when we're trying to augment microfracture or drilling type strategies, the three things that I'm going to go over today are use of hyaluronic acid, PRP, and bone marrow aspirate. I think viscosupplementation is useful for osteochondral lesions of the talus. The way I do it is I have their leg 90 degrees over the table. I alternate the anterior medial, anterior lateral, and anterior medial portals. I use 3 injections over 3 weeks. Don't forget to mark out the superficial perineal nerve so you don't inject through it. Durrell did 3 injections 3 weeks post after arthroscopic microfracture, and he compared it to microfracture alone, and he said the results were significantly improved with hyaluronic acid. Maydon also looked at 15 patients with osteochondral lesions, and he gave them 3 injections, and he found decreased pain scores and increased global functioning within 12 weeks. It lasted about 6 months. Now, PRP, everybody out in Los Angeles guarantees PRP for something, including facelifts. As we know, it's autologous blood product with the platelet concentrations greater than 1.1 to the 10 to the 6. There's many formulations, the 3 to 5 times increase in platelets and growth factors. Theoretically increases the healing on a cellular level, increases the concentration of the growth factors, helps recruitment, proliferation, differentiation. It also has other functions. It's an anti-inflammatory function because it decreases the interleukin-1 beta and helps mediate the metalproteinases. It has a chondrogenic effect, stimulates the mesenchymal stem cells for cartilage differentiation, hopefully increase type 2. Now, Gunny looked at study PRP improved the results of microfracture in his study. However, Cohen looked at poor histologic outcomes with the use of PRP. And Van Bergen also didn't think PRP helped much in the healing of osteochondral lesions in goats. Maydon also compared PRP and hyaluronic acid together to treat an osteochondral lesion with 2 different groups. And they found both helped to diminish pain scores and help function, but PRP significantly improved the outcome better than HA. Gormelli also looked at the effects of PRP and HA in microfracture, and they both had improvement in their scores, but PRP was better overall. Now, but there's a lot of questions about PRP. What type of system? What's the initial blood volume? Platelet recovery? What's the concentration of the leukocytes? These are all questions we don't know. Now, bone marrow aspirate concentrate is another thing that's very important to consider. And of course, many people are using it in many different ways. Now, there are a few studies in humans showing BMAC improving results in microfracture. Wilk showed improved results in cartilage repair in horses. Saw showed better cartilage repair after microfracture in goats. Now, Lisa Fortier also compared microfracture with and without bone marrow aspirate and found superior results in the healing of cartilage defects in her horses. And Kennedy was soaking his oats plugs in BMAC and suggested that improves the results as well. Now, interestingly, Giannini had 3 groups. He looked initially at the open ACI, then the arthroscopic ACI, and then a group just using BMAC. And the results were about the same and said, well, maybe all I need to do is use BMAC. Now, Hannon more recently compared the marrow stimulation with and without BMAC. And post-op MRIs, the addition of BMAC seemed to improve the cartilage border integration with less fissuring and fibrillation. So in conclusion, biologics are a new exciting area, but a lot more research needs to be done to really understand how they work, how effective, how we should be using them. We need a lot more level 1 studies to know really how useful they are as adjuvants to the healing of osteochondral lesions. Thank you.